Hello, my name is Gabe Schreiner. I am in Dr. Jenny's Health 301 Intro to Health Education class, and today I'm going to be talking to you about technology, the advancement of medicine, and its impact on communicable diseases. Some of the learning outcomes of this presentation include understanding the burden of disease on countries and the impact of lessening them, learn how technology has allowed medicine to transcend borders and languages, and discover the ways in which cutting-edge technology and the advancement of medicine can lower the burden of disease. Globally, there are a number of communicable diseases that have been attributed to about 40% of deaths globally. However, this disproportionately affects low and middle income countries, which can reach as high as 50%. Age is a huge factor when considering which population is affected by which disease, as children are much more likely to fall victim to malaria and diarrheal diseases, whereas older adults are much more susceptible to HIV/AIDS and respiratory infections. Why this matters. The World Health Organization is a group of 191 nations that have agreed to achieve these 8 goals, which it calls the Millennium Development Goals. These goals are to eradicate extreme poverty and hunger, achieve universal primary education, achieve gender equality and women empowerment, reduce child mortality, improve maternal health, combat HIV/AIDS, malaria, and other diseases, achieve environmental sustainability, and develop a global partnership for development. All these goals have the common theme of achieving a healthier, happier society globally. Technology and medicine have a long-standing partnership, as technology has allowed humans to communicate across land boundaries as well as bypass language barriers, when that originally made it transfer of data much more difficult. Old methods included physically going to a location to gather data. However, that had many drawbacks, such as time constraints, delays, and inaccuracy when collecting data. Another such technology is called internet-based surveillance technology. One example is called the Global Public Health Intelligence Network. This network scours the internet and looks for keywords that can alert public health officials to possible hotspots of communicable diseases. Also, new tools have been created that help draw links that can answer questions regarding public health issues, like how studying mosquito biology can help control and spread malaria. Now, the Bill and Melinda Gates Foundation is a foundation that has sponsored the Global Grand Challenge Initiative, which gives $450 million in grants to top researchers to find answers to bold medical questions. One such initiative that they funded was the Global Polio Eradication Initiative. This gave $3 billion towards vaccinating 2.5 billion children in 122 countries. That was expected to eradicate polio in 2020. However, due to the recent COVID-19 crisis, they have been unable to administer such vaccines. Some current uses of technology include something called infectious disease simulation, which takes geographical data along with census data to analyze disease patterns and scenarios using computer science. There have also been large advancements in microbial and pathogenic discovery due to low-cost methods that have allowed studying these to be much easier, which has allowed the database of knowledge to grow substantially. These are just a few examples of the forefront of how medical technology is ever-changing and how we can use old ways in new forms. Assessment check. What are the Millennium Development Goals? The correct answer is C, the World Health Organization's objective to end pressing problems that affect global health. How is the Bill and Melinda Gates Foundation a pioneer in medicine? Bill Gates has made a living in the field of technology, and this grant is funding future scientists and researchers, as well as leading the charge to find new and inventive solutions to current health crises. What is the Global Public Health Intelligence Network? The correct answer is B. For references and additional information, you can click these links. Thank you for listening to my presentation.